Thank you, and thanks to all 5 of you for joining us. It's not exactly breaking news that Ohioans don't trust pharmacy benefit managers. Between repeated reports and the egregious use of spread pricing, alleged breaches of contract, accusations of anti-competitive behavior, a misuse of taxpayer dollars, a general lack of transparency, I can't say that I blame them. Several of you, I understand, are making a conscious effort to rebuild trust with Ohio pharmacies and consumers and taxpayers. I appreciate that. But I need you to do that better, and we need you to do that faster. Part of that means changing the way you think about your business, and it means considering models that benefit the Ohioan at the pharmacy counter as much as it benefits your direct client or the other half of your business. It is past time to put patients ahead of profits and Ohio taxpayers before shareholders. So I ask you to do that. I want to ask a few yes-no questions, starting with you, Mr. Kohler, and if you really would answer yes-no, just right to left. Does your company play a role in setting list prices of any drugs?
No, we do not.
No.
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 Okay, thank you. If the administration's rebate rule were finalized as proposed, would you in some way be required to change the way you do business?
Yes, Senator, we would.
Yes.
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 Okay, thank you. If the administration's rebate rule were finalized as proposed, do you believe any pharma company would be required to change the way it does business?
No, Senator.
No.
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 Okay, last yes or no. This question is a short answer if you can. And thank you for your cooperation. What percentage of prescriptions that you fill across Part D actually receive a rebate? Roughly what percentage?
So, Senator, approximately 8% of the prescriptions that we cover in Part D are associated with a rebate.
Okay. Mr. Priest.
Senator, I don't know the exact number. I know overall business about 7%.
Okay, thank you.
About 7 to 8%.
Okay.
Senator, I do not know the exact number, but we pass through 100% of all rebates and discounts.
90% of the prescriptions will be generic. Of the 10% that are branded, about 2/3 have rebates, so it's about 7.
7 or 8% like the others, okay. To recap, PBMs do not set drug prices. Forcing you to change the way you do business, as the administration's rule would, will not change that fact. And while the rule might impact a small percentage of drugs in Part D that receive a rebate, it does nothing to lower costs, as your answer suggests, for the other 90% of prescriptions you fill. Most importantly, absolutely nothing in the proposed rule would require Secretary Azar's former employer or any other pharma company to lower the price of insulin or any other drug. It's important to establish that, so thank you for that. In fact, no pharma company is willing to commit to lowering the price of their drugs if this rule goes into effect. Instead of relying on the administration's claims that the proposed rebate rule will solve the drug pricing problem, we should be focusing on solutions that are sure to result in lower drug prices, like my legislation to allow Medicare to negotiate on behalf of all Part D drugs and to prohibit manufacturers from price gouging. In the last couple of minutes, many of you acknowledge your testimony to the fact that biosimilars have enormous potential to help lower drug prices for all Americans. As you know, biosimilars are approved by the FDA based on safety and efficacy, and in every circumstance that I'm aware of, they have a lower list price than their innovator product. Not surprising. I understand that many of your plans sometimes require the use of higher list price innovator or brand name products over the use of a cheaper, therapeutically equivalent FDA-approved biosimilar or generic. This is short-sighted. It's already having a chilling effect on the potential for a robust biosimilar market in the U.S. My time's about to expire, but I'd like to ask each of you to answer for the record what more your company can and will do and what more Congress should do to ensure the U.S. develops a robust biosimilar product. Let me start with you, Dr. Miller, if you would.
Yeah, so one of the biggest problems facing the industry is the lack of biosimilars that have come to the marketplace. The FDA has approved many biosimilars that still are not in the marketplace. They're caught up in law, in the legal actions. And so shortening the period of exclusivity could make a huge difference in bringing these biosimilars to the marketplace. And so we are strongly supportive and have been for over a decade to get biosimilars out there. And when they are there, we often take great advantage of them to lower the cost for our plant.
Thank you. And Mr. Rice, as you answer the same question, include in it any pushback ideas on manufacturers' tactics like bundling rebates and rebate blocking. So go ahead. Thank you, Mr. Rice.
Yes, Senator. As you've heard previously from my counterpart here, that we absolutely are supportive of bringing more competition into the marketplace. We've seen even in the space of insulins, when we've been able to have that competition of biosimilar introduction, we were actually able to reduce for the members out of pockets their burden by 9%. And so having more competition like that on the market would be extremely beneficial. And we know today that the U.S. still lags Europe in the availability of biosimilars.
Thank you, Mr. Fleming.
Senator,
Could they,
no.
they each have,
Yeah,
they
yes,
could answer the
I
question.
thought you had just had one question. but-
No, it's one for all of them. and-
Everybody answer his question, and then we'll
Thank
go
you.
to Senator Hassan.
Yes, Senator. We need more competition. We love biosimilars. When they do come out, we try to put them in parity position with the originator drug to allow the biosimilar to compete. But the big problem we have today is we need more. More competition allows prices to come down for the same therapeutic area.
And a shorter window, as Dr. Miller suggested, would
sir.
work. Okay. Mr. Prince?
Senator, there's a lot needs to be done to increase competition in the biosimilars market. We're very strong supporters of it. There's over 50 biosimilars that are actually used in Europe. Less than 6 are around 6 or 7 are on the market in the United States. And so the main reform areas could be in the FDA. So there's a series of things, if you follow up, we would love to provide solutions that you could work on. Thank you.
So, Senator, we are very supportive of biosimilars. We generally treat them on parity or preferred over brand. We assess them on the low net cost basis. We don't engage, you asked about bundling. Bundling is not a practice for us that creates a meaningful barrier to biosimilar uptake. We think one of the biggest barriers to uptake of biosimilars is the lack of final FDA guidance on interchangeability.
Senator Hassan.
Mr. Chairman, one more thing. I'm sorry. I apologize. I think their answers really do show the importance of a shorter window and biosimilar on exclusivity. So thank you, Mr. Chairman.